Here we are on to our day 3 of our top 10 things you may not know about addictions. So for point number 3, you can't just count days. In order to work through addiction, it cannot be simply about counting days. If it was only about the addictive behavior, then once the habit was broken or the substance has cleared the system, then the person would be free from the clutches of their addiction. However, we can see that people can go back to their addictions months, even years after they have quit. There are also people that will quit their original addiction and replace it with another problematic behavior. So there's really 2 points I'd like you to speak to on this. One is traditional thoughts on addiction is that if you can get enough space between the last time you used, moving forward, whatever your addiction may be, or practiced your addiction, that the further away, the more in the clear you get. Kind of would like you to speak to maybe why that's not true as well. The second thing being that after a certain amount of time, you feel like you might be in the clear, but the reality is that addiction and your draw to it is always present.
So to go back to the first point about being able to create enough space, like I do agree that it is, like sometimes it is about getting that space, because there are people that might get that space and realize, oh, that was just something that I was doing and I don't need to do anymore. But for a large majority of people that are struggling, counting down days just gets them white knuckling through it and not really understanding why they did it and how to stop it from happening ever again. So they might be fine as long as they're staying up to date with meetings or connecting with people, but when they stop actively working on it, the days itself is not going to be able to keep that addiction at bay. It's about learning what was going on that was making them lead to that, so that way they don't just slip back into it because it's not conscious in their mind anymore to work on it, or because they then find something else to replace it, which is pretty common too.
And I think I've heard that, sort of in typical what we call program talk about sort of a dry drunk, somebody who maybe they've gone off the actual substance, but the behaviors are still there and they actually haven't gotten to the root cause of why they were using in the first place.
And that's how you end up. Just because you stop using it doesn't mean that you're out of the behavior, because dry drunk or just whether it's any substance you're using or behavior that's addictive, is that if you don't address the underlying issue, like for example, if you're prone to not addressing your emotions and that's why you're using alcohol or some substance to be able to distance from your emotions, well then you're still going to need to figure out how to manage those emotions. So either you learn how to deal with those emotions, which is actually addressing the core issue, or you're going to find something else, like I'll go from drinking to then working too much, right? And so unless you actually address why you're doing what you're doing, you'll eventually get back to that behavior. It just might come in a different form.
Absolutely.